Just four things that I'm going to highlight at the beginning. First of all, there has been quite a lot of conversation on these webinars about what's happening with people who get this disease. And in today's London Times is an article titled "Between Life and Death, when coronavirus symptoms last for months." And what this is doing is telling us, and telling all of you who've had long COVIDs, that you are in a community that's about 5% of the COVID survivors in the UK, and seems to be the same elsewhere, that really this is a virus that can cause nasty sequelae. And so the work that you've been doing, I particularly like to pick out Paul Garner, Robin Gorner, and others, is now picking up. And we have actually, I think, got a much wider recognition that what I'm calling long tail COVID is something that's happening everywhere. So just want to thank all of you in this group for bringing the issue out, because it's really important. My second thing is just to summarize on narrative. All in these meetings, we have been constantly saying that there is not a conflict between health and the economy, but we've got to get better words to describe it, because when we talk about false dichotomies or false choices, nobody seems to listen to us. So I've been doing a few bits of in the last few days, and I've just said it's health and economy, and just simple like that. Not loading it with any other stuff. If you get health right, then the economy can come right. If you don't get health right, you're going to have continued challenges. Third point, I think we've been saying in these different webinars that this COVID is not going away. And gradually I feel it's coming through. And this meeting I've just been at just now, saying to a lot of kind of big people in food, just those simple words: COVID's here for at least a year, possibly 2 or 3 years, because basically the world is going to have to live with this virus until it is brought under control, either by incredible, strong defensive action like we're seeing in some countries, or perhaps through a vaccine that everybody can access. But we're a long way away from either of those. So I'm now saying very strongly to everybody, we are going to have to learn as humanity to live with this virus and to be COVID ready. And the fourth thing, it just what we've discussed, particularly over the last 3 or 4 weeks, which is that COVID is a disease of inequity, really affecting poorer people so much more seriously because of how they live, because of how they work, and because of some of the challenges in their socializing. Essentially, I think what COVID does is it reveals the powerlessness of many poor people. So they are not in a position to negotiate better facilities. They're not, if they're health workers, able to negotiate all the protective equipment. If they're working in residential care, they can't negotiate also in special facilities so that they are less likely to get infected. If they're working in meat processing plants, it's really hard to negotiate to get the conveyor slowed down so that it's easier to practice physical distancing. If they're working as crew on a big boat, they can't negotiate alternative sleeping accommodation. And so it kind of goes on that you realize that for many poor people, negotiating the conditions that reduce the risk of COVID just get harder and harder. In fact, for people like myself who are prosperous, it's sometimes really difficult to truly appreciate just how tricky it is to deal with somebody who says, yeah, fine, you want to take a day off, quite understand, but your job's not going to be here tomorrow. Or, okay, fine, you want to continue working as a transport supervisor on station platforms, that's fine, but I'm not able to create any special defenses for you. And if you're worried because you're ill, you better find another job. All that kind of slightly critical and I think unhelpful practice by employers is there. And what we're finding as we look at the numbers is that the situation of COVID becoming worse in poor countries is just on the increase. So those are just 4 things that I wanted to bring out at the beginning. And then I want to show you in this, which is a slightly different graph that's produced by my colleagues in WHO headquarters. This is the material from July the 6th. And that, you see, is really as up to date as we can get. And these are numbers of confirmed COVID cases. Look at this tiny speck in February, which is Wuhan. You know, is it just, at the time, Wuhan seemed huge. It's now tiny. Look at this rapid rise in numbers of cases in late March and early April. That was when the United States and Western Europe and Iran showed their big increases. There was big anxiety about what was happening in Spain, in Italy, in France, in Qom in Iran, and then in UK and other European countries, and then the build-up of cases in the United States. And of course, it was a rapid rise in cases and also a rapid rise in deaths. But now look what's happening. We've got many more cases per day now than were happening even in that period of high transmission when that big increase was happening in Europe. And not only that, if you look at the slope of the curve, of course, it's all a bit uneven because of different cases coming in different days, but it's accelerating really fast. I showed a picture like this 2 weeks ago when it was here before these big bumps came along, and it was beginning to pick up, but this is a serious acceleration. The only saving grace is that the death rates are staying pretty static, reported death rates between 4,500 and 6,000 a day at the moment. But my colleagues are telling me that there are probably 2 reasons for this. They're saying, one, that quite a lot of deaths are not being counted as COVID deaths. And secondly, that they're expecting the death numbers to pick up in the coming 2 or 3 weeks. What does this mean? It means that this virus is definitely going to be continuing to cause trouble in different parts of the world. We're expecting new spikes to occur in Europe, and we're seeing some of them already. We're expecting a continuous large amount of disease in Latin America and in the United States of America, where the numbers are increasing. We're expecting numbers of cases in Africa, which is these greens at the top here, to increase, and South Asia, the lighter green, is here, also increasing, with the Middle East staying pretty static. I mean, all I can say is, in a way, I hate being the person who is bringing not good news. And I was thinking this doing a couple of interviews yesterday, and then I thought, somebody's got to say it like it is. Somebody's got to say it straight, without sugarcoating. You know, here we're having more than 200,000 reported cases a day. We know that between 5 and 10% of these people are likely to have the long tail, nasty illness that's been written about by some of our colleagues. We know that there will continue to be deaths, and it is, I suspect, a really growing number of deaths And we know that health systems will go on being overwhelmed with shortages of protective equipment and the like. We know that as movement increases, because there's been a lot of lockdown during this period, that the transmission will speed up further. And so where does this lead me to as I'm talking not just with you here on these briefs, but I'm talking with different people from governments and businesses around the world? It's really strong statement from me saying the virus isn't going away. We are going to have to live with it as humanity. We are going to have to support each other. We are going to have to look after poor countries. We are going to have to ask leaders who deny the seriousness of this to rethink. And we'll do it politely, because it's not going to hurt if we do it uncomfortably. But we're going to have to continue saying this is a challenge that's with us for the foreseeable future. And when people say, oh, what about the vaccine? I say the following. Yes, there are a lot of possible candidates vaccines being produced. And it will take at least 18 months to put these through the proper tests of safety and efficacy. And then it will take at least another year to get these vaccines out in sufficient quantity so they can reach everybody who needs to have the vaccine, or who agrees to have the vaccine, because a lot of people won't. And we've got to be honest with each other. There's a huge anti-vax movement that is getting very excited, and we've discussed it on these previous sessions. So I'm saying 2.5 years earliest. And if it's quicker, then that's great. But I'm focusing on when everybody everywhere can have a chance of getting this vaccine, because I'm not interested in a vaccine that just goes to a privileged few. That's not going to be good for the control of this pandemic globally. So these are the kind of positions that I'm in at the moment. And I wanted just to now really re-emphasize to you, but do also in a way that builds on what you've been saying to us. Firstly, it's about people making sense of this new threat, wherever they are, whoever they are, being angry, being sad, being frustrated. They won't be joyful. Nobody will be joyful about this. It is a really dramatic and quite horrific recognition for so many people. But if people come together and work together at local level, coordinating between business, civil society, government at the local level and national level, as well as with the scientific community, and if they just work together and say, this is a problem that can only be dealt with through working together. And we're going to go on trying to make that happen, because we know that sooner or later humanity will understand this. With this kind of spread of this virus, over time, everybody everywhere will realize it has to be dealt with by working together. And don't be put off by the leaders who are just refusing to work with others. Don't be put off by those who are announcing that it's not a serious problem and who are just getting themselves photographed, not wearing masks and so on. Don't be put off by that, because you know, we know that this problem is going to continue. You know, we know that the only way to deal with it is through people working together. You know, and we know that this needs collective action. Sorry, it's just a phone call. So I'm basically just making the point that this will be collective action like nothing else. And that's necessary, because it's not going to be on to continue having lockdowns. It's not on to just simply say the rich will be able to look after themselves and it'll be a disease of the poor and the poor will get forgotten about. It won't happen like that, because it actually needs the full participation and cooperation of poor people to get on top of this disease. And it will need the full engagement of governments of poor countries to be able to work and to, in fact, re-establish many of the global communications challenges, many of the global communications routes that are so important. So people will come to understand that it has to be dealt with through cooperation. It'll take time. So we need to be ready. And that's what, working closely with John and with other members of the team, I've been doing to identify the forms of leadership that are necessary for the future, for the world that is capable of coming through COVID, a world that is encouraging tolerance, encouraging collective action, encouraging disagreement as a way of working through issues, encouraging shared leadership, shared responsibility, women and men both doing it, young and old both doing it, all built around messages that are consistent and clear, that are made available for everybody, that become the basis of the new living that will be COVID living, and where there will be a recognition that the rich nations have to work with the poor nations to get them through this. And we, that's me, that's our team, that's all of you, that's your networks, that's Nazim the singer and Vicky the writer. It is Lucky and all the work he is doing. It's all of you who've got different operations around the world being part of the network response that is the way in which this will be dealt with. Don't wait for others to lead us. Don't wait for the current angry brigade of leaders to change their position and say, okay, we're going to see the light. That's not how it's going to happen. It will be through the collective action of people everywhere, working without needing to rely on the number ones, the presidents, the prime ministers, to lead them through this. People will have to do it for themselves. And so part of this, at the heart of it, is about us being responsible for the ways of behavior that will reduce the risks that we face and the risks that others face. I'm going out more now. I have to see friends. I have to go and travel to places and so on. I am masking whenever I go out, and I'm doing it religiously, and I'm doing it proudly, and I'm encouraging everybody I know to do it. I'm physical distancing. I'm conscious that it does look as though this virus can aerosolize, and airborne transmission does seem to be happening. There are more and more people talking about it. Some of you believe you got it. The masking is even more important if we're dealing with aerosolized virus, because 2 meters may not be enough when it's in there, in the air. And so getting those masks on and making sure that everybody advocates for widespread mask wearing and physical distancing is absolutely the key. And at the same time, asking employers everywhere to actually allow their employees to take time off when they're sick and not to force them to work when they really should not be doing so. So I'm really wanting all of us, me, you, everybody we work with, to get at the heart of their thinking some of the basic principles about what we're dealing with, some of the basic elements of communication, some of the importance of focusing on local communities and local action, coordinated local action, but most importantly, just taking this virus seriously. Just a last comment or two before I stop. I'm about to take a break. We're going to take 2 weeks. Partly because we've got a lot of new things cropping up that we've got to deal with, and we worked out that we absolutely have to take some time. But we do want to continue being accessible to you with briefings, not just on COVID, but on other things like food systems and how they can be made more resilient in the face of COVID. Employment systems, particularly for people in the informal sector or in 0 hours contracts, how they can be helped. And then looking at whole sector areas that need support. For example, the whole area of healthcare and the future of public health, and in particular, how we're going to make sure that health services are able to protect people against these kinds of diseases, how a health service is going to support people with chronic illness, how a health service is going to work for people who've got mental illness and stress, particularly as a result of things like COVID. Getting that reimagining healthcare is a vital job for the next few months. Reimagining food systems so that they respond to hunger, so they're resilient, so they promote nutrition. Reimagining employment in areas where people are really put under awful circumstances, like meat processing, fish processing, and other areas. Reimagining public transport, so it's not so risky for the people who serve us. We've got a lot of reimagining life to be done, and that is, for me, the big task for the second 6 months of this year. One where we acknowledge that this virus is going to be with us, and we put our body and our soul into the work needed to actually make the changes. We'll all do that. Now, I'd just like to, gosh, I've just been given this piece of information. Is anybody from Brazil on the call, please? If you want to unmute, if you're from Brazil, that's fine. So Karen, you've just said it. Karen, you just tell us what the news is, please. Unmute yourself. Karen Kaplan, yeah.
All right, I'm multitasking and listening to Tedros's briefing at the same time as yours. And I have a third TV screen on, which shows that Bolsonaro just announced to a hand-selected group of journalists that he has tested positive. And he kept his remarks pretty brief from what I can see so far. I saw it from The Guardian, and then it's breaking news across the world now.
My only hope, I had the same with other politicians who've tested positive, and I'm sure we'd all say this, is may he have a complete recovery and get well really soon.
Indeed, indeed.
Yeah. Thank you, Karen. Now, I'm going to just briefly introduce the team. You've spoken to John. John, hero, and thank you. I'm so sorry I was late. Not exactly my favorite habit being late. But John, thank you for being on the call. You told people about our piece on local level action being absolutely key from the British Medical Journal. And I think you sent the links to that. We've got another one coming on what other kind of things you need to have as a series of performance indicators for whether or not you are COVID ready. It's a bit interesting. It says you don't rely just on the numbers of people who are reported as having the disease. There are certain other variables that become really important. So John and others in the team, thank you for all your help with writing. Twee has been producing another of her amazing 3-minute videos. Twee, where are you? Are you here? You're here. Okay. Now, Derek Owen, are you on today? There you are, Derek. Tell us about what you've been doing on the video and where you're checking in from.
I'm in Los Angeles, and yeah, we're working on this video talking about systemic inequalities, and also I think the message at the end of it is about connecting, sharing ideas, and that kind of thing. And to that, I don't know if we're ready to do this, but the idea that we had for a couple of the shots we want to do, and my colleague BJ is set up to shoot some of this, is that everybody turns their camera on, and we're just gonna, continue talking and so forth and film some of that. So I'd say if anybody doesn't want to be filmed or doesn't want to appear in the video, don't turn your camera on. But we encourage you to be on here, and we'll get some of the footage of everybody here doing this, which is kind of a part of the message that want to be spreading around to everyone.
Thank you. Together with Derek is BJ Golnick. BJ is a sound guru and is somewhere here. He's
hey there.
Take the picture. While we're all assembling, please turn on your picture if you possibly can. If you don't want to, I quite understand. but it's lovely if we can see. Just let me greet Catherine. Catherine, got a picture of the Golden Gate Bridge behind her, and because she's from the West Coast as well, and she actually is quite friends with Derek and BJ. All these things occur through connections. Magali is on. Magali, I saw you just now. There you are. You're on the top of my screen. Saber, part of our team, is on. Saber is in from Tunisia. William, my brother, is on. You can see him. His camera is looking from underneath. Nice to see you. And Flo is on. I'm hoping that she's going to turn on her machine. I just want to say, Sihaj, thank you for giving a bit in the chat. Robin, thank you for being on, wearing a very beautiful mask, which looks much nicer than mine, which is in my pocket. And I just want to, while you're all coming on, if you don't mind, just really give a special shout out to Rojan Dal, who's in Kathmandu. Holly Wheeler, thank you for all the work you're doing on leadership. Sihaj in Bangalore, I know that. And there are various, Godfrey Philippon, I don't know where you are, but Godfrey, I know that you're calling in, looks like you're calling in from somewhere, from where I just can't find out where you are. It went wrong on my screen. And then I wanted to go to Nazim. Nazim, where are you? Are you in Gambia or not? The Gambia, I should say.
Hello, everyone. Yes, I'm in the Gambia. I'm in the Gambia, it's in Nabarro.
And thank you for yet another song and the beauty of your song. And I understand you did a big concert with one of your songs at the Partnership for Maternity.
Hello, David. Hello, David. Papa Sek from Senegal.
Oh, hello. Thank you for calling in.
Thank you too. Since the last time we met in Geneva.
Very, very good to see
you.
So
I agree strongly with you when you talk about vaccine. As we know that it can take long for having good vaccine, I think that the main thing we have to focus is to make people commit themselves to the barrier measure. We have to vaccinate consciousness first before expecting to receive the vaccine against the COVID-19. I think that if people are vaccinating consciously, they will respect the sanitary measure, wearing mask, physical distance, and everything. So far, it's the only thing we can really use to reduce the spread of the disease. Thank you so much.
Papa Sek, it's so lovely to see you again. Merci beaucoup. Thank you for being on and joining us from Senegal. Nazim, thank you for joining us from the Gambia. Really good. I just checked. BJ, have you got your picture? Did you manage to get something that you liked?
Yes, sir. We got it. Thank you very much, guys. Thank you, everyone.
Thank you very much, BJ. Okay. Now I just want to get on. So good that Papa Sek's here. I mean, when you just in one of these moments, you're seeing somebody you work with and suddenly bang, they're there. It's just a big turn on. Thank you very much indeed. Now, I see that we've got some comments coming in on aerosol transmission. That's deliberately put in by me because it's an issue that's been in the press recently. Very happy to have a discussion about that. But I thought that with Anthony Zwi being here in the middle of the night, we can see it's pretty dark out the window. I think, Anthony, you're probably in, I'm not going to guess which city you're in, but I know where you are. Just give us a little bit about what's happening in Melbourne and why the state border has been so profoundly controlled and what the strategy is, because it's quite an interesting situation what's happening in Victoria.
Yeah, good evening. Well, it's evening for me or early morning. Nice to see everybody. Yeah, the situation in Victoria is pretty worrying at the moment in terms of an increase in, increase in numbers of positive coronavirus tests in Melbourne from a very low base some weeks back. And in the last few days, those numbers are accelerating upwards. And the government there, which is the sort of state government, has taken some rather extreme measures to try and control the situation. And I think it does raise a lot of very interesting issues. I mean, first of all, it appears that the way in which the virus, to some extent, escaped from, very good control mechanisms was through some faults within hotel quarantines, which were set up actually basically people who've returned from overseas travel who come into Australia are required to be in quarantine in hotels for a 2-week period. And what seems to have happened in Melbourne is that the system that was set up to manage that was contracted and subcontracted out, and there were a number of sort of failures within the system, such that the virus really extended beyond some of the people in those hotels to some of the private security contractors, and into their communities. So that's one thing. It sort of, I think, reveals failures within, or the importance of ensuring that implementation models and training of all the people involved and high levels of education and all of that has to be maintained in an ongoing way. That's one sort of key lesson. The second big lesson is that, and which has been, I think, a huge jolt to the Australian community, is that it also become apparent that a number of hotspots are present in public housing, basically, I mean, these are like 20-story public housing estates in northwestern Melbourne. Yeah. And a number of positive cases were observed over there. And there's been what has been described as a hard lockdown in those buildings because of fears that the virus could spread quite rapidly within those settings. There are only 1 or 2 entrances into buildings which have several hundred people, very narrow corridors, 1 or 2 lift shafts, inadequate, ability really for physical spacing, and highly vulnerable populations. So a lot of refugee communities, large families on sort of public welfare system. And so there's a big concern about further spread within those. In fact, our acting chief medical officer has described those buildings as vertical cruise ships. That's how he sort of described it. So it sort of raises the issue of sort of public housing or low income housing, high concentrations of people, and whether cities have taken adequate precautions to anticipate and prevent occurrence of spread of COVID-19 in such settings. That's another sort of issue. And the third one is really around this hard lockdown, which was introduced very quickly and really led with a police presence as opposed to a public health and public education engagement and the involvement of civil society organizations. And that was also seen as a negative experience. Obviously, the communities involved were both fearful and worried, anxious and resentful. So there's certainly lessons about that as well, even if one's moving quickly, how to engage communities and make them part of the solution rather than feel resentful and stigmatized. And in fact, in the last few days or today, a wider range of control measures have been introduced in Melbourne more generally. In Victoria, there are controls between the Australian states and the Victorian state. And there's quite a large area within Melbourne out of which people are not supposed to go out of those areas at all. The basic instructions are to, you know, get on with daily living in those settings, which is you can go out if you have to see a doctor or you've got urgent things to attend to, or to get to work, or to go and purchase your basic supplies, but otherwise you should be in your home. Whereas in those apartments, it's a very strict lockdown, not supposed to go out at all.
Anthony, it's so important that what you've just told us. Of course, I think any one of us on this call would not have gone in with the police and the military at the front end into the high rise.
Yeah.
It just, everything we've learned is you've got to engage with the local leaders, sit with them, meet with them, work out with them what the best way to deal with the situation is. That's how Mumbai, Dharavi slum has just, I think, got somewhere. And thank you very much, Sabrina. I just want to hear from a couple of other people before we stop. I want to do a bit of a dive into Mexico, and I'm just giving warning that the people on from Mexico, please be invited by us to give a latest picture. And I'd like to ask James Ritchie to talk about subcontracting of workers, particularly working in the food sector, and just to give everybody just a very short vignette about why subcontracting is one of the things that seems to be driving COVID in certain industries. But just don't forget what Anthony Zwi said, that if you go in with the police first, particularly with communities that are having tough times with law enforcement, it can create some big tensions. And I just hope that it's calming down now, Anthony. Thank you for that. Chris Shipton is our illustrator. Chris is, you can see his illustrations, and you just getting it highlighted. We're just getting, Chris, as you can see, is combining all sorts of different idioms here. Thank you very much indeed for that, Chris. And yeah, good. Okay, fine. We'll check to see how that one comes out. Thank you, Chris, for your screen. Can we just go now to either of the groups from Mexico that I've seen, Ruti or Carlos and Veronica? Did you want to unmute yourselves and just say a couple of words about where things stand in your country? I can't see the pictures at the moment, so I'll see if I can get back. Yes, I can. And let me just, yeah, Carlos and Veronica, come in, please. Tell us how things look.
They look dire. Numbers are growing. We have not been able to control the epidemic in any sense. People are dying. Lockdown is working only in certain areas, as you well put it. People in need have to go to work, have to do their daily chores. Either they eat or they don't. We've been in lockdown now for 4 months, and we manage when we can to go out and supermarket or whatever, doctors, medicines. But things don't look good, and our government people are not working very consistently on this epidemic.
Yeah. So we've been working, Carlos connected through a person that I used to work with. In fact, we all used to work with, who is absolutely fantastic. And what we've been learning from Carlos, not all of you on this call realize it, is just absolutely how challenging it is in Mexico because of the inconsistency of political leadership. It really is a very, very serious situation. Also, the Mexico-US border looking good. Does anybody else from Mexico want to speak? Carlos, thank you. And Veronica, thank you. It's so good to see you both. Let me just move now to James Ritchie. James, do you want to come in? You have the floor now.
Thank you, David, and good afternoon, good morning, good evening to everyone around the world listening to this very important discussion. I just raised the issue about subcontracting because if we're talking about leadership and we're building communities through the pandemic, building communities which are going to be resilient, and working together, then we've got to look at the employment relationship as well. And subcontracting is about removing responsibility from the prime employer to contractors and subcontractors and so on. And so nobody really takes responsibility or accountability for the working conditions. And we've seen this in the meat sector, particularly in Germany, where there have been outbreaks in meat processing plants. And those outbreaks are amongst a migrant workforce, which works not for the meat company, but for a whole series of subcontractors. And those subcontractors often are a little better than gang masters who bring people from Eastern Europe and outside Europe to work in really substandard conditions, to have substandard accommodation, to really create the conditions when there is a zoonotic disease like COVID-19, for that disease to flourish because of the actual working conditions. And as we're moving through, I think it's very important to get back to having direct employment relationships, where there is a relationship between an employee and employer, which is built around the community and which respects people, accords dignity, and allows people to have a say over their work conditions to defend their health and safety as part of a core tenet, a core principle of defending ourselves and protecting our communities against zoonotic diseases like this one and like the ones which will emerge in the future unless we take care of our communities in this way. Thank you, Dave.
Thank you very much. Hold on to that. The challenges of migrant labour. Ruti, I was offering you the floor just now. 30 seconds now from you. Just quickly to introduce yourself and tell us where you're at. There you are, I can see you now.
Thank you. Thank you. I'm from Mexico City. And things in Mexico are not looking good. Just yesterday, we received the news that now the government, they're going to give the accounts of deaths and contagious by week, not daily, because there were some news that they found out officially, with official records, that the number of deaths in Mexico are much, much higher than the ones that they have been reporting. So that's really very distressing, because then we can't trust what the government is saying or what the government is doing. And the reopening in downtown Mexico City is like crazy. There are tons of people around.
This is really very disturbing. Lloyd said, how long will lockdown last? And said, you can't go on with lockdown. So I want to be clear. Okay, we don't like lockdowns, but you've got to put in place community-based public health capacity to detect people with the disease, to isolate them, to find their contacts, isolate them. You've got to have that in place, because that's the only way a country can survive. If you've got a lot of COVID, it's going to be hard work to get that set up. I mean, that's the current Mexico challenge, the Brazil challenge, the UK challenge, the US challenge. But we must not assume that lockdown is the primary control measure. It's good quality community-based public health work is the key, backed up by movement restrictions, but really trying to do it as little as possible, because it hurts the poor so much. So I quite understand this, Ruti. I quite understand it, Loy Rego. But I want to stress, we need to do everything possible not to have to go on with punishing lockdowns because of their damage on people's lives. I saw Rebecca nodding her head because she's seeing it in Chile as well. Now, there is a really tricky issue. Here is the issue. people are saying some of this COVID can be airborne, which means it can go into very tiny, tiny droplets that instead of just landing just around 1 meter outside your mouth, they can go into the air and travel long distances. And there are people saying, how important is this airborne spread? And the trouble is, we don't know. But I've discussed it a lot with the colleagues in WHO who work on this, and they're saying for the majority of transmissions, it is droplet spread. It is within about 1 meter and 1.5 meter absolute maximum. It's due to coughing when faces are not covered. It's due to sneezing. It's due to shouting, talking like I am. Droplets come out of your mouth. But a small proportion, very small proportion perhaps, of transmissions may occur when the virus is actually turned from being a droplet into being a tiny particle in the air, a nanoparticle. And that seems to be happening under certain circumstances. What are the circumstances? One, when you're singing or shouting loudly. It seems that that can aerosolize. Two, perhaps if you're playing a musical instrument. We're not sure. So when these scientists wrote saying to WHO, talk about aerosol transmission, my only answer was, does it make a huge difference to control strategies? Answer, not much. You still have to work on face protection, physical distancing, but you probably have to be particularly careful when you're in a choir practice or a karaoke bar or in some other place where aerosolization might occur. As we pack up now, I just want to say that Catherine has written to say the high-level political forum reviewing progress on the Sustainable Development Goals is opening today. Do I have specific messages? I'm just going to say COVID's not going away, it's here to stay, and it shows why the Sustainable Development Agenda is so important. My session starts at about 8 o'clock tonight. Matthew, I don't think sneezing through a simple face covering encourages aerosol. Tracy, the challenge is to reach those who feel invincible and others who are complacent. How can we engage people to think and plan forward, to do critical thinking towards a new normal? Answer, that is what we should be spending all our time on, Tracy, because certainly that's all I'm going to do for the rest of my professional life, is connect with people, connect, to get them to work with me on thinking through the new normal. And then lastly, Tracy has said we must have a focus on First Nations and Indigenous peoples. Many of their support systems have been suspended due to the crisis, and there's no plan in place. Let that be our parting thing. There are poor people everywhere for whom support systems are broken. Homeless people, people who normally depend on ready prepared meals or food handout, people who depend on special nutrition at schools, and of course, First Nations people and other Indigenous people. This COVID is revealing the frailty of their systems. We've got to continue to work for them. And that's why, for me, I've shifted my position. I'm now becoming much more focused on the societal changes that we've all got to work for, because this disease is going to go on troubling us for the foreseeable future. Thank you for joining us. Thank you very much indeed, everybody all around the world. We continue these discussions with the next one on Thursday at 8:30 in the morning European, 7:30 in the morning UK, and all other times adjusted. But we will stay connected, and I'm very, very keen that together we find a way to continue to work on the charting the COVID-ready future, because that's what I think has to take all our time. And with that, I say goodbye to everybody in the team, and wish you all well, and just going to actually ring off now because we have to start the next thing now. So with thanks to you all, big wave, bye-bye, have a good next few days, stay strong.